It is so unfortunate what is going on in Congo and Uganda, and what is really sad is that the Ebola virus, has actually been transferred from Congo to Uganda as well, is has become plagued by the Ebola virus. Um, yeah, so we were just trying to update you guys on what is going on. I'm just reading off of the CNN article, and it reads, this is for the 12th of June 2019. Headline: Ebola outbreak enters truly frightening phase as it turns deadly in Uganda. So if you haven't read it, it says the Ebola outbreak in Democratic Republic of Congo, the long feared jump across borders, with 3 cases confirmed Wednesday in Uganda, including the death of 5-year-old boy who had the virus. The World Health Organization and Ugandan health authorities said Tuesday that the Congolese boy had traveled from Congo on Sunday and entered Uganda with his family and sought medical care. The other 2 confirmed cases are the boy's 3-year-old brother and his grandmother, 50. They are being treated under isolation at the Buera Hospital Ebola Treatment Unit in the west of Uganda, the country's Ministry of Health said. In a tweet Wednesday, who said the boy had died Tuesday night. That's very sad. The young patient, 5-year-old index case of Ebola, died last night. 2 more samples were sent to UVRI and have tested positive. We therefore had 3 confirmed cases of Ebola in Uganda, the tweet said, referring to the Uganda Virus Research Institute. The ministry added that 8 people who had been in contact with the family were being traced. The Congo outbreak is both the second largest and second deadliest Ebola outbreak in history. More than 1,300 people have died since it began in August. The epicenter is in North Kivu and Ituri provinces, among the most populous in the Congo and bordering Uganda, Rwanda, and South Sudan. Concern had been mounting that the infectious disease would cross the border, underscored by an increase in the number of cases in recent weeks. Pressure on who to declare international emergency. Dr. Jeremy Farah, director of Wellcome Trust, a UK medical research charity, said that while Uganda was well prepared to cope with the disease, global health authorities should be ready for more cases in the Democratic Republic of Congo and other neighboring countries. The epidemic is in truly frightening phase and shows no sign of stopping anytime soon, he said in a statement. There are now more deaths than any other Ebola outbreak in history. The West Africa epidemic of 2013 to 2016, and there can be no doubt that the situation could escalate towards those terrible events, those terrible levels. Uganda Health Ministry said that the boy and his grandmother had been vomiting blood, a severe symptom of Ebola, when they had presented themselves to doctors. Ebola is a horrific illness that ravages the human body, said uh, Branchtai van Lith. I'm not sure if that's right, but anyway. Save the Children's Country Director, said the Children's Country Director in Uganda. This first death of a child is a sickening reminder of the dangers of this disease. Who is likely to come under pressure to declare the outbreak an international health emergency? In April, the health body said it did not constitute a public health emergency of international concern. Wow, 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 wow. Who defines a public health emergency of international concern as an extraordinary event that constitutes a public health risk to other states through the international spread of disease and to potentially require a coordinated international response? And it says, however, the Congo outbreak has proven difficulty to bring under control because of community mistrust and violent attacks on healthcare workers. A step up in the national response with full international support is critical of where to contain the epidemic and ensure the very best protection for the communities at risk and for the health workers working to protect lives. Farah said this needs to be championed at the highest political levels, including the United Nations and upcoming G, G2O. The Uganda's health ministry said it was vaccinating frontline health workers and people who had been in contact with the family. It said people should report any symptoms, including unexplained bleeding from anybody, opening, vomiting of blood, diarrhea, and muscle pain. It appeared to the public to suspend social norms like shaking hands and hugging, and called on border districts to suspend mass gatherings such as weddings and markets and in places of worship. That is the end of that CNN report. This is very sad, people. This is very, very sad. If there's any disease that is so bad, it must be Ebola. Ebola, because it's airborne. It's just one of those diseases. It reminds me of the film Contagion and such movies. And it's scary, right? If this disease were to get out of hand, in 2013, 2016, during that period, I remember how scary it was. We just hear it on the news, and we think, oh man, can we have like a situation where people just get sick and it just keeps, um, the outbreak just keeps growing and growing and growing, and obviously we would like to see a situation where it's stopped again, and there's no guarantee that these diseases will just suddenly disappear and be gone forever, but we can only hope for the best. So I ask just encourage you people, viewers and listeners, to just pray for our brothers and sisters over in Uganda and the Congo, DRC Congo, and I know DRC Congo has been going through a lot of things with to do with war, and now it's Ebola, and so let's just keep our brothers and sisters in prayer and just hope for the best outcome in this situation. Um, I think at this point it should definitely be treated as an international crisis, because if human being is suffering out there going through this kind of thing, it's potentially can affect you as well. You're just as a human being as they are. So there we are, folks. Thank you very much for listening. Thank you very much for watching. Please subscribe to this channel. More news is on the way. And have a good day. Thank you.